Why publish or present data from outcome of CME program? To say it simply, to demonstrate the value of CME to all stakeholders, from clinicians to education professionals and pharmaceutical industry professionals. And there are several avenues to present these data. One, during a regional or national professional meeting. This could be a clinical or a medical education meeting. This can be done in person or online, and this can be done in the form of a poster, and it can also be accompanied by a voice-recorded presentation of the poster, which has been done very often during COVID. Every accepted presentation for a poster is also published in the form of an abstract in the Association Clinician Journal. And the other avenue to present data for CME outcome is in the form of a full paper in a clinical journal. The selection of the venue depends on the objectives that you want to achieve, and I'll review some of them as I go through this example. So this first slide shows example of publication of outcome data at national meeting, and namely the American Academy of Dermatology, or AAD, and the the Academy of Allergy, Asthma, and Immunology, or QADI. You see a screenshot of the poster from AAD on the left, and you can see an excerpt of the final abstract that was published in the Journal of Asthma and Clinical Immunology, the Journal of QADI, on the top right. The presentation at AAD was also coming with an audio recording, which you can see an excerpt done here from a screenshot with Dr. Leo. And not represented on this slide, the poster at AAD was also published in the Journal of the American Academy of Dermatology. So now going deeper into this example, this was a program on atopic dermatitis that followed a tethered format, which is a format that contains activity for both clinician and patients. Clinician and patients programs are aligned and cover similar topics. Questions are asked to patients using a polling system, and the responses are showcased during the clinician programs. So in addition to demonstrating the impact of education to patient and clinician, the tethered outcome analysis identified several areas of disconnect between patients' understanding of their disease and treatment expectation, and what clinicians thought patients wanted, and what they prioritized when making treatment decisions. So when we looked closer at the data, we thought that the conclusion of the tethered analysis was more of a research topic and would be more suitable for presentation at AAD, which gathers researchers and clinicians. And then we chose to present the data illustrating the impact of patient education at QADI, which is a more clinically focused venue. The primary advantage of presenting at a national meeting is its large exposure to a variety of stakeholders: clinicians, allied health professionals, patients, industry and advocacy representative, students, interns, researchers are all attending the event and are exposed to the data you present. The presentation at a national meeting helps acknowledge the critical role of pharmaceutical companies in the provision of continuing medical education. For those in the education industry, it provides data to characterize the impact of education and help raising awareness about remaining educational knowledge and competence gap to help advance medical education and continue to provide the education that match the evolving needs of clinicians. For the clinician who attends the conference, learning about the presentation can offer opportunity for self-reflection about their own practice. How would they compare to their peers whose responses are represented on this poster? Who have they done if they had been in the same seat? Presentation at national meetings are also ideal venue to highlight the role of partners in the education, such as patient advocacy group in advancing patient outcome. And here you can see that AFA, the Asthma and Allergy Foundation of America, was an important partner, and as indicated by the presence of the logo on the posters and as an author in the posters. And last but not least, this presentation provides value to the faculty. And here at Platform Q, we always include faculty in the authorship. It engages the faculty as much as we can. And here you can see a photo of Dr. Leo. And what also this does, it provides Dr. Leo in that case with an additional publication for his portfolio. The second slide illustrates a peer-reviewed publication in the International Journal of Clinical Practice. The CME program was an overactive bladder management program, and the project included a post-activity survey of a group of clinicians that participated in the program. And the survey included an in-depth phone interview about practice patterns, attitude, and barriers to overactive bladder management. Just to give you an idea of timeline, the CME program took place in 2018. The survey was done over a few month period in 2018-2019, and the paper was published in 2020. So we're looking at a period of 2 years, which is usually much longer than the publication of a poster. A poster can be published within a year, depending on the timing of when the National Association meeting is scheduled. The survey and its analysis were completed in partnership with a professional who specializes in the evaluation of education programs using qualitative research methods. So again, highlighting partnership in the order to be successful in getting meaningful data. The goals of publishing an article in a journal are to disseminate outcome findings and contribute to the body of evidence about the factors that contribute to gaps in clinical practice and patient outcomes. Some of the work may have been presented in a poster, as we described before, but the articles allows to more in-depth analysis and sharing a more extensive amount of data. An article can be peer-reviewed or not peer-reviewed. And a peer-reviewed article means that a qualified person has reviewed and validated the content, sometimes requesting changes to be made to the content, depending on the totality of the published evidence. Publication in a peer-reviewed journal usually is a sign of high-quality work and pertinent findings for the industry and the clinical scientist. And as you can see, there is notable absence of logo and acknowledgement of partners up front, like we had in the poster. Instead, this is usually done in footnotes or at the end of the article. And same thing, partnerships are acknowledged in the form of authorship. Education funding source is also most often disclosed at the end of the paper. So different goals, different presentation. The most common readers of medical journals are clinicians, pharmacists, hospital medical director, quality improvement personnel, and researchers. Clinicians who read articles focusing on outcome of CME and identification of remaining means often do so to learn solutions to improve care quality within their own settings. Publication of a QI initiative, a quality improvement initiative, is a perfect example. A QI initiative are often performed in closed system with processes that apply to the system. While an initiative that improved healthcare delivery worked in a system may not work in another system as exactly described in the paper, clinicians can learn and adapt models to their own needs and processes. And last but not least, I would like to point out that publication and presentation at national meeting and publication in a journal usually are costly enterprise. Thank you for your attention.